Hey, my dear friends, here speaks Dr. Rey. I'm a plastic reconstructive surgeon, and welcome to my YouTubes. And I want to talk in lay terms about sagging of the breast. A big misconception is that the breast sags at 62 or that breast sags at 52. In reality, at 22, your breast is already starting to sag. And it's just women? No, men sag too. Look at your wonderful dad. What are the causes? Excuse me. The causes are sun damage, just gravity. Earth has 9.8 meters per second squared. It's brutal gravity. That hormonal explosion in your teenage years, the hormones go so high it thins your dermis and your breast can fall. Pregnancy, same reason, explosion of hormones, or the production of milk itself. It's so heavy on the breast it can fall. Weight gain, weight loss can make your breast fall. And so what are the steps nowadays, starting with the most invasive to the least, that we can take care of this problem, which is a big problem for a lot of women. In the old days, we made a cut this way, a vertical cut and a horizontal cut. And this was one of the most common ways to lift the breast, called the WISE, W-I-S-E pattern breast lift. The more modern surgeons over the years have become disenchanted with this lift, which looks temporarily good, and then it falls. You can add an implant to this type of lift, but to the vast majority of races on Earth, which are pigmented, it can leave a very bad scar, especially the horizontal limb, less the vertical. Let's talk about the lollipop. For massively ptotic, fallen breasts, we can do the lollipop, which is just a vertical limb. If you observe the anchor, the WISE pattern, the part of the scar that looked bad was the horizontal. So the surgeons very intelligently modified the breast lift to just incorporate a vertical. And you can put an implant which will add more volume, lift you more, and look good for longer if you take care of it. But what I prefer today is the crescent lift, which is a little scratch up here. We close the deep layers with ligatures, but the superficial layer, we just glue. We use Dermabond, a human glue. This acrylic glue will stay on through your various showers for several weeks, I find, and will give a very positive scar, almost invisible, if not invisible. Okay, and you can add today implants which are saline for the women who are a little more nervous about silicone. You can use silicone itself of different profiles, and you can use stem cells. So we take out the fat from the abdomen, the sides and the back, the inner thigh, the arms, whatever you hate, and we leave a little six-pack, separate the stem cells from the fat. Always going to be some fat in the stem cells, and we inject the stem cells. Stem cells create growth factors, which will make the skin above it even more youthful, I find in my practice. So there is a surgical option right there. Let's talk about lasers. The radiofrequency laser has been used in the breast. It will tighten the tissues, kind of like putting plastic in the microwave. Works very, very well. And another thing that works really, really well is some of the creams nowadays. So we're going from very invasive to least invasive. But before I mention that, I like to mention the Brava bra, B-R-A-V-A. Remember, I told you there's two ways you can lift the breast. You can cut the tissues and lift them, or you can just add volume. Imagine a balloon on my shoulder. The more you blow into it, obviously the more it lifts. What happens if you add air to your car lifts. So the Brava bra will give you about half a cup, and it just uses suctions to increase the tissues, okay? Or you can simply just inject stem cells into the breast. No lifts at all. The volume itself, I have developed a technique that the volume itself will lift your breast. Finally, let's finish up with creams. I myself, I'm approaching 60, and my torso is very young. And the reason is because I mix vitamin E, retinol, which is vitamin A, a little bit of ground aspirin, which gives a little bit of a chemical peel, and I use vitamin E and benzoyl peroxide with a little bit of shea. So vitamin A, which is retinol, and shea butter has been the only two things shown in the literature to actually make your dermis thicker. It's kind of like thicker elastic, it bounces back together better, okay? So those are some wonderful little tidbits about the position of your breast and to create a perkier, more youthful looking breasts. Thank you very much. This is Dr. Rey, over and out, just because I love you. Thank you for joining our YouTube.